Okay, good afternoon, everyone. We're so happy to be with you today on Zoom for our June 2026 session of Community Health Learning Collective, also known as CHLC. My name is Maureen Burns. I'm excited to be here with you today. For those who may be new to this group, CHLC is simply a shared learning space for community health workers, promotoras de salud, CHRs, and our allies. So those who may not be CHWs, but those who support our work and work alongside of us. So every month we meet on Zoom, and each month we feature a different topic speaker that's relevant to the work that we do as CHWs. This group is a free group. All are welcome. It's welcome to CHWs. We have local people from Chicago and Cook County and Lake County, but it's also open to any CHW, no matter where they're located. So we're glad that you all have chosen to share time with us today. And I'm going to tell you just a little bit about today's session. Today we are doing harm reduction training for CHWs. So we're really thrilled to welcome some speakers from Rosalind Franklin University who are going to be talking to us about harm reduction, what that looks like for community health workers. So with that, I'm going to pass it over to our amazing speakers, Chelsie and Dr. Chambers. Please take it away.
Thank you. Thank you so much, Maureen. So while Chelsie starts to share her screen, I'll just introduce everyone. So I'm Dr. Pamela Chambers. I am one of the anesthesia faculty in the Rosalind Franklin College of Nursing Nurse Anesthesia program. Today, as mentioned, we're going to talk about harm reduction, and this is one of the doctoral nursing programs projects that all of our doctoral students complete. And so they've developed a program where we're teaching members of the community how to reduce fentanyl deaths. So today we have one of the members of the team, Chelsie Nunez. Chelsie is an experienced ICU nurse, as all of our students in the nurse anesthesia program are. And Chelsie developed this program with Tyreka Davis, another experienced ICU nurse who could not make it here with us today. We have a new additional team member, one of the medical students, and his name is Charles. He's going to introduce himself to you really quickly before Chelsie begins.
Yeah, as Dr. Chambers mentioned, my name is Charles Barthauer. I'm currently a second-year medical student at Rosalind Franklin University in the Chicago Medical School. Before starting this, I have about 3 years of harm reduction experience, and I'm really excited to hear from this community today.
Thank you, Charles. All right, so without further ado, Chelsie will introduce herself and she'll begin the presentation.
Hello, everyone. My name is Chelsie Nunez, and this is a project that Tyreka Davis and I are working on. Unfortunately, she couldn't make it today. She really did want to. But like Dr. Chambers said, we are part of the Nurse Anesthesia program and the College of Nursing at Rosalind Franklin University. Dr. Chambers is our project advisor, and our presentation to you is how you can save a life by preventing opioid overdose with Narcan and fentanyl test strips. So just a little bit about Rosalind Franklin University. It was founded in 1912 and it's named after the trailblazing scientist, Dr. Rosalind Franklin. She was the one that discovered the double helix formation, and that really revolutionized healthcare and science today. So we serve one mission, and that's to serve humanity through the interprofessional education of health and biomedical professionals. And this is through discovery of knowledge and also thinking of ways on how to improve wellness. We have 30 plus graduate programs, and we also have a long history of advocating for diversity and inclusion. So one university, so Rosalind Franklin University, but six schools. So for example, Tyreka and I and Dr. Chambers are part of the College of Nursing. So this is the one right over here. And then, for example, Charles is a part of the Chicago Medical School. So even though we are part of different schools, we are part of one university. And I think that's what we love about Rosalind Franklin is its emphasis on interprofessional work. So us talking with Charles about his experience and and then how we can kind of combine our knowledge together in order to improve our outcomes. So if everyone could please take out your phone and go ahead and scan this QR code and take the survey. One, we'll just do a few minutes, and then once everyone is finished, we can go ahead and get started with the presentation.
And one of the reasons why the survey is so important is because we want to try and impact your knowledge and what you know about this topic. And once we finish the presentation, we'll ask you to do the survey again. So if you would please, it really helps us out if you would take the survey and share with us what you know. And then at the end, share with us what you have learned.
What is the unique code number? Question 2 is asking for that.
Oh, you can skip that. That was something that we thought about having for some of the groups. Just skip it or write 0 is fine.
Okay.
Does everyone need a few more minutes? I don't want to rush.
Yes, maybe just a few more. I'm still working on
Perfect.
it.
Yeah, no problem.
I think we're safe to continue.
Okay, sounds good. All right, and then if you guys are still finishing up, that is totally fine as well, but we'll go ahead and proceed with the presentation. All right, so these are our objectives for the presentation. So we want to review background information on the opioid crisis, also look at common opioids, recognize the signs and symptoms of what an opioid overdose would look like, understand Narcan and how it works, and the purpose of fentanyl test strips, and then also demonstrate confidence in administering intranasal Narcan and in using fentanyl test strips in order to test substances. So those are our objectives for this presentation. So, what are opioids? So, opioids are drugs that relieve pain that can cause euphoria, sedation, and respiratory depression. There are different types. There are natural, which is going to be morphine and codeine, semi-synthetic, like heroin, and then we also have synthetic, like fentanyl, which is going to be a big player, something that we're going to talk about a lot in this presentation. So, something that Tyreka and I were talking about, like Dr. Chambers had said, we both worked as ICU nurses before. We both have given opioids and we know how to give it properly in a controlled environment and how to do it safely. So we know that it can relieve pain in a very safe way, and they are actually pretty good for patients if you use it in the right way, but that's not always the case. So commonly misused opioids are going to be oxycodone, hydrocodone, morphine, codeine, and methadone. And then fentanyl is the most commonly misused opioids, and it's about 50 to 100 times stronger than morphine and the leading cause of overdoses. So, an interesting thing about fentanyl is that it's often mixed with heroin and cocaine unknowingly. So, a lot of times when these overdoses occur, people don't realize that it was laced with fentanyl. The reason why it is so dangerous is that it's a high risk of overdose due to how potent it is. So, even a little bit over goes a long way and can cause death. And also, it works fast. So, it's rapid onset as well. So, Tyreka and I researched how the opioid crisis affects us on a national, state, and also county level. So, on a national level in the United States, approximately 105,000 people have died from a drug overdose, and nearly 80,000, or roughly 76% of those deaths, involved opioids. This is not only a huge burden to healthcare and people's lives, but also it's an economic burden. It costs about $550 billion. And this is a graphic from the CDC. So it says that 217 people died each day from an opioid overdose in 2023. So looking at Illinois, um, 3,261 opioid overdose deaths happened in Illinois, and this is from 2022. 8.2, this is an 8.2 increase from 2021. So a huge jump in just 1 year time span. And since 2013, synthetic opioid overdose deaths have increased by 3,341%. So again, a huge increase in not a lot of time. And then we looked over two counties. We looked over Lake County and also Cook County. So Lake County is where Rosalind Franklin University is located at, and it is a lot of nearby cities and counties that we were looking at. So in Lake County, there were 116 accidental overdose deaths, 84 involved fentanyl. And then we also looked at Cook County just because it's more highly populated and it's very close to Lake County, and there were 1,026 opioid overdose deaths in Cook County. 87% involved fentanyl. So, what does all this mean? So, looking at it from a national, state, and then two counties, Tyreka and I reached the conclusion that this opioid crisis is a problem everywhere. It's not just located in one state or one county or one area of the United States. It is a nationwide problem, and it's a problem everywhere you go. So that was kind of eye-opening experience looking at that. Um, Also, just before we segue into Narcan and fentanyl test strips, we also want to address what harm reduction is. So the best way to put harm reduction is that if you're going to do it safely. In a perfect world, it would be everyone shouldn't use or misuse opioids. Everyone shouldn't do that. But that's not, unfortunately, how it works. And we can't tell people, just don't use it because addiction is also a disease. So some people just can't help but use it. So what harm reduction is providing resources to people who are at risk or know of people who are at high risk for using opioids and potentially overdosing. So we're going to go into Narcan or naloxone and fentanyl test strips and talk about how those help out with harm reduction. So, what is Narcan? Narcan is the brand name for naloxone, and what it is, it's called an opioid receptor antagonist. So, the way that opioids work in our body, we have opioid receptors. So, when we ingest opioids, those opioids take up those receptors and then causes those side effects of euphoria, sedation, and then, if there's too much of those opioids, it's going to cause that respiratory depression and death. So what an opioid receptor antagonist is that it takes away those opioids off the receptors and reverses the effects. So that's going to help them start to wake up and remove those effects of respiratory depression. So that's how naloxone or Narcan works. It can be given intranasally, so through the nose, or injectably. The great thing about naloxone or Narcan is that there's no serious effects on those not suffering from an opioid overdose. So we're going to go over the signs and symptoms of what an opioid overdose looks like. But let's say you find someone, the signs look kind of clear that they look like they are having an opioid overdose, and it ends up they're not having an opioid overdose. There's not going to be no serious effects if you give naloxone anyways. It's kind of a better safe than sorry. At least we tried to intervene and in the case that it was an opioid overdose. This is a temporary solution, very big emphasis on it, and you must still call 911. So what Narcan is not, it does not work on overdoses from non-opioids. So this is stimulants like cocaine and ecstasy, or benzodiazepines like Valium and Ativan. And one of the most important things, it is not a treatment for opioid use disorder. Narcan is very simply a rescue resource in the case that someone is suffering from an opioid overdose. So it's not used, they're not going to be treated, they're not going to suddenly not be addicted anymore. This is just simply a rescue medication. So we're going to watch a video on how to administer Narcan.
Here's what comes off a bowl of strawberries when you drop this device in the water. These berries are fresh from the store and already rinsed under the tap, but within 10 minutes, the water changes color. What floats to the surface will change how you feed your family.
We're in the midst of our country's worst overdose crisis. In 2021, 220 people died each day in the US from an opioid overdose. If you suspect someone may be experiencing an overdose, here's what you can do to potentially save a life. How do you know if someone is experiencing an overdose? It may be hard to tell whether a person is high or it's an overdose. If you aren't sure, treat it like an overdose. First, check for signs of overdose. Those may include small or constricted pinpoint pupils, falling asleep or losing consciousness, slow, weak, or even no breathing, choking or gurgling sounds, a limp body, cold and or clammy skin, or even discolored skin, especially around the lips and the nails. Call 911 if you think someone may be overdosing. Next, give the person naloxone if it's available. Naloxone is a safe medication that can quickly stop an opioid overdose. There are two forms of naloxone. First, a nasal spray. That's a pre-filled device that sprays medication right into the nose. There's also an injectable medication that's a solution that you inject into muscle or under the skin. Naloxone is easy to use, and it's small to carry. Make sure you read the instructions and check the expiration date before you give it to someone. Naloxone can restore normal breathing within 2 to 3 minutes in a person whose breathing has slowed or even stopped due to overdose. More than one dose of naloxone may be required when stronger opioids like fentanyl are involved. Naloxone won't harm someone if they're overdosing on drugs other than opioids, so it's always best to use it if you think someone is overdosing. After you give naloxone, try to keep the person awake and breathing. Next, lay the person on their side to prevent choking. Stay with the person until emergency assistance arrives. Remember that most states have laws that may protect a person who is overdosing or the person who called for help from legal trouble. Coming upon someone experiencing an overdose can be scary, but if you follow the right steps, you may help save a life. If someone you know is at increased risk for opioid overdose, you should carry naloxone and keep it at home. Thanks for watching. I'm Dr. Ali Raja. For more emergency care.
All right. So, that was just a video on how you can use Narcan. Dr. Raja does a very good job explaining on the signs, and we'll go over that as well. But one thing that Tyreka and I liked is this graphic. This is also shown on the boxes of Narcan if you ever need to use it. It has these instructions because when something like an opioid overdose occurs, sometimes you can kind of go blank. You don't know what to do. So we like the fact that they have these instructions on there. So, if something were to happen, you know exactly what to do and the steps. So first, trying to wake them up. Second, tilting the person's head back. Third, making sure to how to hold the Narcan plunger. And then fourth, placing the nozzle in one nostril and then pressing firmly. And then making sure to call 911. Again, this is just a temporary attempt at a fix. You do need medical personnel there to kind of continue on that care. And then also you can repeat these steps every 2 to 3 minutes, like he said. All right, so what are fentanyl test strips? So, in comparison to Narcan, Narcan is a rescue medication. That means that the opioid overdose has already occurred, and it's given to kind of help reverse it. So, it's a rescue medication. Fentanyl test strips are more of a preventative measure. So, what they are small strips of paper that can detect the presence of fentanyl, usually in different kinds of drugs like cocaine, methamphetamines, and heroin, and then also drug forms like pills, powders, and injectables. They may not work in all scenarios. For example, they can't show how much fentanyl is in a sample, just that it's simply in it. And it may not work as well in large amounts of methamphetamines, MDMAs, or diphenhydramine. So again, these are a relatively newer form of harm reduction tools, and this is going to be a preventative measure. This is not a rescue medication like Narcan, but it can still help with preventing opioid overdose. So we have another video on how to use fentanyl test strips, so we'll watch that as well.
Fentanyl is a synthetic opioid 50 to 100 times stronger than heroin. Illicitly manufactured fentanyl is often mixed into other substances like cocaine, heroin, or fake pills, and you cannot see, taste, or smell its presence. Fentanyl test strips can detect fentanyl's presence, help users make informed decisions, and reduce overdose risk. Always test your substances before using. Multiple substances, even from the same source, can have varying levels of fentanyl, so it's best to test everything you plan to use. To test powdered substances, place a small, crushed sample about the size of Abraham Lincoln's hair on a penny in a clean container. Add sterile water, about 1 teaspoon for meth MDMA or half a teaspoon for other substances. Mix thoroughly. Insert the wavy blue end of the test strip into the water for 15 seconds. Remove and read the results in 2 to 5 minutes. 2 pink lines means no fentanyl was detected. 1 pink line means fentanyl was detected. This is the opposite of reading a pregnancy test. A single line on the right or no lines is an invalid test, and you should retest with a new strip. Remember, no test is 100% accurate. To reduce overdose risk, never use alone. When necessary, call the Never Use Alone hotline and always carry naloxone. New York State residents can have free naloxone and drug test strips mailed to them just by visiting oasas.ny.gov.
All right. So just to kind of overview, I like the way that the analogy they use. It's an opposite of a pregnancy test. So again, you hold on this end on the blue part, and then you insert the wavy lines into your sample. One red line is positive for fentanyl, and then 2 lines is negative. So, what are the signs that someone needs help? This was kind of addressed in the video with naloxone and Narcan, but we can go over it right now as well. So, first one being unresponsiveness. They're usually not able to wake up or get a response. So that's why the first step to do before administering Narcan is trying to get them awake and see if they'll wake up. Slow or no breathing. So usually they're shallow or even stopped. Pinpoint pupils, even in dim light. Blue or gray skin. This is usually due to lack of breathing, especially on the lips, fingertips, and face. Gurgling or choking sounds. It's also known as the death rattle. A limp body, cold, clammy skin, and then slow or no heartbeat. So that's when it gets, that's when it's pretty bad and intervention needs to be made immediately. So this is the time for our group activity. It's just going to be a group discussion. I'm going to be asking a few questions, and then we can go ahead and discuss it. I just want to remind everyone that this is a safe space. We want to remain respectful of other people's stories, comments. This is a very sensitive topic for a lot of people. We want to refrain from using names or anything like that, any identifying factors if you're going to talk about someone that is impacted by opioid overdose or substance abuse in general. And we also want to treat this as whatever is said during this discussion stays in this discussion. So that being said, that leads to my first question. So has substance use affected your life or someone close to you? And then kind of piggybacking off of that, why do you think people start using substances in your community?
We would love it if someone would share how this may have affected you or someone in your life. You don't have to give details, but it helps to kind of bring points home, especially to someone else who may be listening. Maybe someone has had questions or maybe thought they saw something. It can mean a lot for other people who are here with us today. If you've been affected, if you would share it with us. Yes, Miss Yao.
Sometimes I think people use substances as a form to like self-medicate due to like lack of access to care. They are not able to see, pain specialists or something, or even mental health specialists. So they just use the what they have available.
Very true.
Yeah, that's a great point.
I'll share that I've had several people that were close to me who have been addicted to opioids. And I also think, I agree with what was just said. I also think there's a lot of unresolved trauma that people have in their lives that leads them to that point of really trying to escape, So I think a lot of people might start using substances seeking that escape, and then before they know it, they're addicted to it. And that's the other thing that I've heard from a lot of people who specifically use opioids is that it's really hard to stop. I've known a few people who have really desperately wanted to stop using and just kept not being successful at that.
And that's one reason why it's so important for community members like you, healthcare members like you, to know about this information. You just never know who you might run into. It may not even be someone that you're actually caring for. It may not be someone whose home you went into to provide services. Maybe they have a visitor, or maybe you're just at Walmart. It's good to have this information. Chelsea, let's go to the next questions.
Yeah, for sure. So what stigmas have you noticed surrounding overdose or drug use in general?
How about, has anyone ever heard that drug use or opioid overdose just happens to certain people?
Yeah. Caitlin put in the chat, people being scared to be judged when they're trying to seek help. Dr. Chambers, I think definitely there's still a bit of stigma that like it's only certain groups or certain people. I think another thing I've heard specifically when it comes to our topic today is I think a lot of people still really misunderstand harm reduction, and people think like, oh, if we're giving test strips, we're giving naloxone, that we're somehow like encouraging this. And so one of the things that I heard recently that I think helps push back against that is that I think it takes someone who's addicted to opioids like an average of 10 attempts at like quitting or getting clean before they are successful. And so just thinking about the fact that naloxone potentially keeps people alive long enough for them to potentially move into recovery. So yeah, I think that there's still a lot of misunderstanding that's like people having that very hard line, like just say no to drugs type of attitude versus the reality.
And you can think of harm reduction as death reduction. You know, let's look at it that way. We want to keep people from dying so that, as Maureen said, they can get the help that they need. So, you know, maybe that makes it more palatable for someone to actually get the help they need or to help those who might need it. Maciel, go ahead.
I do a lot of Narcan training at Roberti House through Northwestern. And a lot of times, like we do it when we do blood pressure screening. So oftentimes, like I'm like, would you like to take, get trained on it, or would you like to take this Narcan? Like I'm really pushing it, and they're like, no, we don't need it. I don't know anybody, but it's like, well, it's a lot of times it's accidental. So you just never know when you might need it, and sometimes it's the medications that were prescribed from our doctors. Like you just never know. And I always tell them like it's best to have the Narcan and never need it than need it and not have it. So I'm really just pushing it like how to spot like an overdose and just because it's still like such a stigma, like like people, being or like being addicted to drugs or like having an overdose. But it's just like we run into accidental overdoses so much, and you can save a life so easily just by training the community. And so I really like coming to these and like making sure that the community is aware.
And you brought up a really good point, and Charles, I'll call on you in just a second. You brought up a really good point. Most people get introduced to opioids from something their doctor or another provider has given them. You know, we're anesthesia providers, and often we have to give people medications for pain. And some people may get opioids prescribed to go home. We don't prescribe medicines that they go home with, but many times having surgery is often the first introduction to an opioid. And even people who are not prescribed the opioid, they have it in their home. And then someone else sees that medication in the home, and that's how they have access to it. So there's so many ways that opioids can get into a susceptible person. Charles?
Right, yeah, and going back to stigma a bit, as a lot of us have mentioned, and Caitlin even said that people are afraid to go to community clinics and organizations because they don't want people they know to see them at the clinics. And I've seen that in the harm reduction that I've done in the past is that people don't want to go to a clinic or even to our outreach sites for that reason. And it's not just the general community, in my experience, that I've seen that have a stigma against people that use fentanyl specifically. It's also other people who use drugs can be very hard on people that use fentanyl. So, kind of within their own community, I've seen them even more nervous to seek out those services.
Yeah, so that's a lot of great points being made, a lot of common themes. Like all of you have said, just a lot of stigma surrounding it, and it's kind of like a touchy subject. People think it's weird, like why are you giving these things to people? You're just enabling it. That's one thing Tyreka and I talked about a lot. It's just breaking that stigma. It's a really, really big barrier in terms of trying to prevent deaths from occurring. So that leads us to our next question, and that's what role should healthcare, or in this case, community members, play in addressing substance abuse?
I think the biggest thing is always educating the community.
Yes, absolutely. Education is forever going to be like the forefront of how we're going to at least try to mitigate this crisis for sure.
I think normalizing and answering questions that people might have, like what we just talked about, the stigma or people maybe thinking it's not for them. I think for us as CHWs, that's a big role we can play. Like last year, I did one of these trainings and I received like a bunch of boxes of naloxone and like I had extra. And so I was giving it to like my friends and my family members. And some of my family members who, didn't have any bad intentions were kind of like, why are you giving this to me? Like, when am I going to use this? And so that's like a real opportunity to just let people know that like a drug overdose is an emergency situation. It's not planned and we never know when it's going to happen. And so, put this in your car and hopefully you'll never need to use it. But I think that's one role that we can play is like reinforcing this is prevention, it saves lives, and it's up to everybody, right? It's not just up to like some people.
And you brought up a great point. At the end of this presentation, you all have available to you several boxes of naloxone and fentanyl test strips. One of the things that's so important with this training is we really want you all to be able to put what you've learned into use and to really have some impact on saving lives. So, for that purpose, to that end, we have provided to you several boxes of naloxone and fentanyl test strips. So when you go by the office, do not be shy to take whatever you need because we really want this to have an impact on the communities you're working in.
Yeah, and there's definitely no harm in just having one available in your backpack or if you know of people that are might be at high risk, just offering like, hey, do you want this? It's really good. And I think on top of that, when Dr. Chambers and I were together and handing, boxes of Narcan out or fentanyl test strips, we made it a safe space that people were usually asking, like, oh, can we have some of this? Can we have a little bit of more? And I think that's great because we made it so that people weren't afraid to ask. And I think that's a big thing is breaking that stigma, making them wanting to prevent things from happening. They want to be ready and after I hope, with the presentation, they felt a little bit more safe, a little bit more, prepared just in case something happens. And then, so our last question is what were your thoughts in general on Narcan and fentanyl test strips and harm reduction in general before this training?
No thoughts before the training?
I was about
I
to say.
never used fentanyl test strips.
That's the number one thing that we get, and that's what we expect because it's so new. It's such a not a lot of people know about it, and that's a good point. Um, so we're glad that we were able to at least educate you a little bit on fentanyl test strips because I didn't know about it either until Tyreka and I researched it.
Ms. Macias has participated in the training before. So, it's really great that so many of the community members, I was discussing with Maureen before we started, how fentanyl deaths are starting to trend downward. And that's really what we want to see. Unfortunately, there are new drugs that people are taking for recreation. And, each year as healthcare providers, we just have to work and do our best to try and prevent needless deaths from things like this. But doing more and more training in harm reduction is really having an impact. And so, at least for our purposes, we like to find out what kind of impact this may have had on you. Did you learn anything? Or Was it any different from training you've had before? That's kind of why we ask some of these questions, because we want to know how to make our training better and how to attack different things. If you're seeing things in the communities that maybe you're not getting a lot of education and training on, or if you're seeing drug overdoses that no one's talking about, those are the kind of things that we love to hear about.
I had one question or thing I wanted to mention, which is I feel like there's still some misunderstanding in sort of the general public about the safety of naloxone. So could you I don't want to say anything wrong, but like my understanding is that for the most part, even if you were to come upon someone and maybe you think they're overdosing and they're not, like it's some sort of other medical problem, naloxone is still pretty safe to use. Like, can
So
you
in the
talk about?
doses, sure, in the dose that's in the nasal spray, it shouldn't cause any harm for other issues. Now, we do use it in the hospital and we give it IV. So we use it in larger doses that can potentially have other effects. But the way that the nasal spray has been formulated, it's formulated so that it can help save a life if someone's had an overdose outside of a hospital. But it's not so much that it can cause some of the other problems that we might see in a hospital. So if they're not responding to you, if they're on the ground, if they're not breathing, and you've got some naloxone, you'll probably help them out to use it. If they've passed all these unfortunate tests that they might need it, it's good to have it so you can help them out. Candice, go ahead.
Hey, how are you? I thank you for all the really, really good information that so I've used Narcan before. I used to work in a shelter and you saw quite a few heroin addicts. There were drugs all that went all through that place. And I wasn't now, I've never done the Narcan with the needle. I've done the one with the nose that goes up the nose. And I've done that about 6 times. And I did it in a shelter. Now, I had no informal training or anything like that. I literally read the instructions. We went on YouTube and like now there were supposed to be people there that were trained in that they would administer, but there were times those people were not around, and there were about 8 times I had to do it myself. I'm glad I don't work in that setting no more. That was not fun. Seeing people foam at the mouth and all this crazy stuff. I mean, that's not, nothing that I would want to repeat, but um I think um, shelters, I mean, you see it because of the high activity of everything that goes on in shelters. But yeah, that's my experience with Narcan. It's not, I mean, and every time I see it, I'm like, this is needed, but it's not something you necessarily want to, hey, it's in my back pocket, like hand sanitizers, it became my new normal. That's just a little joke, but I'm just throwing that out there. Okay.
Yeah. Thank you. Thank
Thank
you
you
for
so
that.
much.
All right, any other last thoughts? Okay, so just real quick, these let me see real quick. These are our references, but I'm going to go back to this post-test. Like Dr. Chambers said before, it's going to be the same test, ask the same questions. If you all can take this, that would be great. We just want to thank you so much for allowing us to present to you guys. This is not only helpful for Tyreka and I, and also Charles as well, but we hope that this was helpful to you guys. We did a lot of research on this, and but a lot of what is going to be impactful for our research is your input and how we deliver the presentation. So please take this survey, and thank you for giving us this opportunity. It means a lot to us.
Thank you so much.
Thank you.
Yeah, thank you all for being here and for this really great content. I want to just give a moment for people to continue to complete the survey. I'm doing it myself, and then I'm just going to do one or two announcements before we get going. So while people are working on that survey, I am gonna put something in the chat. I want to just give a reminder about our next session of CHLC, our July session. That session is going to take place on Monday, July 27th, 12 to 1. You should have already received the invitation and the flyer, but that session is going to be focused on healing after trauma and abuse, including a discussion about healthy coping skills, moving from a victim identity to a survivor and thriver identity, and how to work towards long-term emotional regulation. So that's going to be a great session. We're excited about that. We hope that many of you will be able to join us for that session. And I also just once again want to say thank you so much to Dr. Chambers and Chelsie and Charles and everyone from Rosalind Franklin. We really appreciate you being here and doing these trainings. It's so needed. And also thank you to everyone for sharing your time with us today. We know you're busy CHWs, and so we appreciate you being here to learn about this topic.
Thank you. Thank you for having us.
Absolutely.
Thank you so much.
Thank you.
Did anyone, I know people are probably still doing the survey, but if anyone has any other questions for the presenters about naloxone or about fentanyl test strips, please go ahead. Also, if anyone needs help accessing these tools, like wants to know where to get naloxone, please feel free to email me and I can help you figure that out.
All right. Thank you, Maureen. I'm going to go ahead and disconnect.
Yeah, we can go ahead and conclude. Thank you.
Thank you.
Thanks,
Thank you so
everyone.
much.
We hope to see you next month. Have a good one.